Hello everyone. Welcome again to our another topic for today. So we tackle today about the perineal and genital care. So when we say perineal and genital care, it means of cleaning and washing the external structure of the pelvic area and the genital area. So what are the purposes of this perineal and genital care? First one, we need to cleanse the perineum. Number two, to prevent the infections. Number three, to provide comfort. And number four, to teach self-care and genital hygiene. So what are the equipments needed to our perineal and genital care? Number one, we need the flushing tray, the cotton balls, the flushing can, washcloth, warm water, receptacle for soiled cotton balls, kidney basin, soap, and bedpan. So these are the equipment needed for our perineal and genital care. Let's start with our assessment. In assessment, there are two. So assess the client's perineal area and extent of soiling. So in assessing the client's condition of the skin and the extent of soiling of the perineal area is to soak the perineum causes more discomfort to our patients. So urine or the feces on the skin can result in skin breakdown and infections. And number two, we need to determine the client's capabilities. In identifying the patient's capabilities, we need to know the extent of the help to be given to our patients. Next one, let's proceed to our planning. In planning, uh, first one, we need to wash our hands. So in washing our hands for infections control. And number four, we need to assemble the equipments, or we need to prepare all the equipments needed to promote the efficiency of our perineal and genital care. And next one, we need to identify the clients and explain the procedure. In identifying the clients, this is to determine if you are giving care to the right persons. And next one, we need to explain the procedure to our patients to lessen the apprehensions to our patients. And then we need to provide privacy. In providing the privacy, it shows respect and interest in the patients as a person. And after that, we need to place the clients in a dorsal recumbent positions. In placing the client in dorsal recumbent positions, this is to obtain the clear view of the area. And after that, we need to place a rubber sheet under the client's buttocks and place the clients in a bedpan to protect the bed from becoming soiled. And after that, expose the perineal and drape. So for female, it should be diamond drape. So in exposing the perineal area, minimum exposures lessens the embarrassment and helps to provide warmth. So again, we need to wash our hands and put a clean gloves. In putting the clean gloves, that is to prevent contact with the body, contact to prevent contact with body secretion. So let's proceed to perform the procedure as follows. So first one, we need to, for the female, for our female patients, it should be flush the perineal area with warm water. In flushing the perineal area, uh, is to flush excess vaginal secretions, and also place cotton balls in a receptacle or basin with soft sand. So first one, clean the vulva from the anterior portions toward the anus, then regards the cotton ball. So wiping in these directions lessen the possibility of contaminations. And next one, we need to gently separate the labia with gloves and fingers and clean between the labia majora and the labia minora. So always clean gently to prevent pain and avoid pressure on the suture. For example, for the postpartum or for the surgical patients. And with labia separated, we need to clean the clitoris, urethral meatus, and the vaginal orifice so that to be able to observe any unusual finding in this area. And then after which we need to clean the thigh using the stroke away from the perineum so that to prevent contaminating the clean area. And then we need to rinse and pat dry. So soft residue must be rinsed well because it will cause skin irritations. Wet or damp area is a medium favorable for growth of microorganisms. So these are the uh, steps or procedure for our female clients. So for our male client or male patients, so place the bath blanket down to the mid-thigh to provide privacy to our patients by draping. And after that, for a male patient, move the cotton balls from the tip of the penis down its length towards the pubic area. So to prevent ascending infections. And after that, we need to hold shaft of penis. If in case that is uncircumcised, retract the foreskin, then pull back after. So retracting the foreskin is necessary to remove smegma that collects under the skin, which may facilitates bacterial growth. And after that, use a circular motions to clean the meatus and the glans penis in outward directions for us to be able to clean the all areas. And next one, we need to also clean and rinse the sputum. So the scrotum tends to be more soiled than the penis because of its proximity to the rectum and causes foul odor. And after that, we need to turn the patient on his side, wash and rinse the anal area for comfort of our patients. And next one, and after that one, replace the bath blanket with top sheet or linen, so to keep our patients warm. And then clean all the equipment and put in the proper place. So in cleaning all the equipment, that is to be ready for the next use. And then remove and discard the gloves that already used to prevent contact with the secretion, and wash our hands to prevent transfer of microorganisms. And next one, we need to evaluate the clients for peeling of comfort. So there are many patients or some patients verbalize their feelings after the procedure. So if there is any unusual observations on the perineal area. And lastly, we need to document. So record the procedure and pertinent observations like redness and swelling on the area to provide accurate data on the patient care. So these are the procedure or step by step for the perineal and genital care.